how is thyroid surgery performed? Will there be a permanent scar on the person's neck, and will there be a change of their voice or loss of voice after the surgery?
Thyroid cancer usually we see in very young population, and most commonly in the females. So the surgery, people are not like worried about that. There are certain things like whether the scar is formed on the neck permanent. I would say definitely yes, definitely there will be a scar in the neck. But nowadays what we are doing is something called laparoscopic or endoscopic thyroid surgery, wherein we don't cut in the neck. So there is an approach wherein we do some neck small cuts in the breast and in the axilla. From there we can remove the thyroid gland, wherein we are avoiding the possible big scar which is seen in the thyroid cancer patient. So that is will give very much cosmetically good results for thyroid cancer. And other than this, major patients worries about the whether they will lose a voice if you do surgery for thyroid. So I cannot say this like there will be you will lose a voice, but there is a chance that the voice quality might change. There can be pitch can become low and the hoarseness of voice can be there, because thyroid gland is associated with the very closely. There are two nerves in the like main nerves which like supply to the voice box. But if there is any injury to the nerve, then the change of voice can be there. But the risk is usually 1%, that is out of 100 patients, 1% can have that injury. And other than that, there is sometimes the tumor itself might be infiltrating or it is going into the nerve. That times, to give good clearance, to give good margins, we may have to go for sacrificing of the nerve. That time you can have change of voice. And sometimes there is a very much extensive tumor, you may have like complete loss of voice or difficulty breathing pattern also. But with the advent of new technology and the minimally invasive procedures, nowadays we don't see much complication, and complication rate is around like 1%, you can say. For any procedure we have that much rate.